Compared to the normal population, men who have had a history of prostate cancer diagnosis have double the risk of depression, anxiety, or both. And what's really worrisome is that even 15, 16, 18 years after the diagnosis, we find that the prevalence for those conditions is much higher among men with a history of prostate cancer diagnosis compared to men in the general population. And this is a systemic issue. So it's not just in Canada, it's not just in the US, we find it in Australia, we find it in Europe. So it's all over the place. So this is very serious because this means that there is another factor and an exponential factor that affects the quality of life of this particular population. It's not just functional. And a lot of the time we think, oh, urinary problems, sexual problems, no wonder why they're suffering. But in fact, there are others. Alicia Morgan from Boston calls them the X factor. There are things like, treatment regret, worrying about family and friends, not knowing what to expect, wait times between appointments, between scans, and so on. That all together compile a lot of anxiety and issues that remain buried, because men present well. So you might think nothing is the matter, when in fact there is a lot the matter. So we're looking at a silent epidemic that is preventable. It's not just function. We're very good at monitoring testosterone levels, but we're not very good at monitoring people's anxiety levels.